Hi, and welcome back to the Drama-Free Healthy Living podcast. I'm your host, Jess Corder. I am so excited that you're joining me for today's conversation with Dr. Judith Joseph. We get into some really fascinating stuff about the prevalence of high-functioning depression that so many high-achieving people experience, and really get into how to stop masking invisible pain and really start living. So a little background about Dr. Judith. So Dr. Judith Joseph is a Columbia-trained psychiatrist and the founder of and chief investigator at Manhattan Behavioral Medicine, which is New York City's premier clinical research site. She's also a clinical assistant professor in child and adolescent psychiatry at NYU Langone Medical Center and chairwoman of the Women in Medicine Board at Columbia University's Vagelos College of Physicians and Surgeons. She has some incredible wisdom to share about how to recognize high-functioning depression, how to start building resilience instead of just grit. Talks about eliminating self-destructive patterns, set healthier boundaries, and more. So she talks about her own story. She talks about the protocol she developed to help people dealing with high-functioning depression overcome this and reclaim their joy. So I'm really excited to share this talk with you guys today, so I hope that you enjoy. So enough of me talking. Let's get to the episode. Welcome to Drama-Free Healthy Living with Jess Cording. I'm your host, Jess Cording. I'm a registered dietitian, health coach, and author, and I'm here to help you streamline your wellness routine and establish a sane, more balanced relationship with food and fitness so you can reach your goals without losing your mind. On this podcast, we'll talk about nutrition, exercise, self-care, mindset, and more. I'll be bringing you interviews and expert insight on the topics that matter to your health and wellness. Dr. Judith, welcome to the podcast. It's so nice to see you.
Thank you for having me today.
I was really excited for our conversation because your book is so special and so needed. Just really appreciate the work that you're doing. And I love asking people to I love a good origin story. So I would love for you to share with our audience, what inspired you to go into behavioral medicine and mental health in the first place?
I originally started off as an anesthesiologist, and I went to medical school thinking that I was going to do a surgical field. Anesthesiology at the time was like super competitive, and I believe it still is, and paid a lot. You supposedly have good hours, and then you have a life and you're a doctor. But when I started my anesthesiology residency, I found myself very bored and also having anhedonia, which is a lack of feeling and pleasure in things. And I just thought, I went into medicine to help people, but I don't even get to talk to my patients because I put them to sleep and then I wake them up, keep them alive through the surgery, and then I never see them again. And I was having this existential crisis, and I thought, I can make a change or I can keep going. And I ended up applying for a position in psychiatry at the same hospital at Columbia, and I got it. And when I started a residency, I didn't think I had any trauma. I didn't think there was anything wrong with me. But then when they offered the residents low-cost therapy, I said, I really don't need it, but I'll do it because everyone else is doing it. And boy, was I wrong. I had no idea that I was someone who was struggling with high-functioning depression, anhedonia, unresolved trauma. And that was really the beginning of how I felt that a lot of people were like me. They didn't know what was happening in their backgrounds. They didn't understand their behaviors. And, what a privilege it would be to, reach people like myself who are masking depression and hiding their struggles behind a mask of pathological productivity. And so I went into psychiatry and never looked back.
Thank you so much for sharing that. Something I think is really important about your book is that you really call out the fact that even little t trauma can have a big impact. And I think there are a lot of people that are out there, thinking that, well, I didn't have this horrible catastrophic thing happen or that, but then they start, digging in a little bit and they realize that, oh, actually, these other little traumas are also valid and having a far-reaching effect. And I really appreciate the way that you talk about that in your book.
Yeah, many people don't realize that when they have painful experiences that shape the way that they see the world and the way that they interact in the world, that these are traumas. And in medicine and in research, when classifying a trauma using the PTSD diagnostic criteria, usually a trauma is considered like life-threatening or an assault to either yourself or that something that you've witnessed. But things like going through, a toxic relationship with someone who verbally, belittles you, or, going bankrupt or going through a divorce, or, even things like scarcity trauma, like growing up with very little and not knowing whether or not you're going to have food. Those are all considered not traumas. But if you tell someone that, they become very deflated and they're like invalidated. And when I do my research studies, I say, off the record, I believe you. This is a trauma. This has shaped the way that you see yourself. This has shaped the way that you view yourself in the world and the way that you interact with others. All of this impacts you. And so I wanted to change the way that we thought about trauma by creating my own trauma inventories and including those painful experiences that shape us into my research. And then as people go through the trauma inventory, they'll say things like, wow, I never realized that was a trauma. I just kind of pushed it out of my mind, or I just forgot about it. And then I explain to them that that's your brain's way of coping to push down the trauma so that you don't have to think about it or feel that pain in the moment or go into fight or flight. But over time, that trauma does sneak up in many different ways. It sneaks up in the choices that you make and the people that you love and the way that you view yourself.
I am so grateful that you called that out. I have been working in this field for almost 15 years, and I find so often that people who are not aware of their trauma or they don't feel like they're allowed to work on it because it doesn't count, it can be much, much harder for those people to make progress. And I think that's just such a big part of why this is so meaningful. And in the book, you explore, high functioning depression. When I was reading the book, I was like, wait, this isn't already like research. This isn't already like, I feel like it's something that is so prevalent, but not actually very well researched or discussed publicly. And I would love for you to define for our audience what high functioning depression is and what some of the signs are.
I was actually surprised that it wasn't researched either. So I thought, well, I have a lab, I have a team, I'm interested in this research. So I'm going to write a protocol and I'm going to submit it to an IRB, which is a research board. And I'm going to carry out the first study in the world on high functioning depression. And I did. And it was just published in February of this year. But it is surprising. And in my lab and in many labs across the world, something that people use is like the DSM-5, which is the Bible of Psychiatry, and then the ICD codes, which is like the worldwide coding. And at the end of all the symptoms, of depression, at the very end, you'll see a box that says, does it impact your functioning or is it causing significant distress? So think about the millions of people in the world who have symptoms of depression, who are over functioning, showing up for others, being the rock, being the parent, being the educator, being the entrepreneur, and not breaking down, in fact, over functioning. And they don't acknowledge their distress because they have to show up for others, or they just don't have the tools to express it, or they just weren't brought up that way. Well, these are people who are neglected and who don't check the box. So they don't technically meet criteria for getting treatment. And why are we thinking about mental health this way? I just thought that was a broken model because we see this renaissance happening in physical health now with longevity science, where people are saying, don't wait for the heart attack, prevent it. Don't wait for the broken bones or the broken hip. Let's prevent it with HRT for menopause and perimenopause. Why aren't we thinking about this for the same way for mental health? You think about cancer. No one's saying, let's wait for the cancer to spread and then do something. People are saying, let's prevent it. Let's empower patients with the information that they need to prevent a cancer so that they make better choices about their lifestyle, their diet, the way that they go about their regular day. But we're not doing that for mental health. And so I thought that this was an opportunity for me to do that as a researcher and as a therapist. It's very difficult to come across someone who's doing both, but I know what the science says. And I know that if we wait for people to break down, we're not going to have the amount of mental health professionals that we need to address this. We're already seeing that, during 2020, the psychiatric organizations were asking psychiatrists to come out of retirement to address this need. There's a dying breed of us. We don't have enough of us. In some parts of the country, there is one psychiatrist for every 30,000 patients. I mean, I could barely keep track of 30 patients on my own. So if we are not thinking about this differently, and if we're not empowering people with the tools to prevent a mental health breakdown, then we are in for a crisis that we just cannot address. And I want people to think differently about their mental health. I want them to know the science of their unhappiness. So, what are the things making you depressed? What are the things taking away from your joy? And once you understand the science of your unhappiness, then you understand the science of your happiness so you can do the things to prevent a breakdown.
In your research, have you found that there is any kind of discrepancy between how much this affects men versus women, or is it kind of across the board, or not really sure yet?
Depression and anxiety impact women twice more than men, twice as likely. I mean, I have to say that twice sometimes because it's so astounding.
Yeah.
And why aren't we yelling this from the rooftops? Why don't people know this? And it makes sense. When you use a tool in my book that I try to democratize for mental health, it's called the biopsychosocial model. Biologically, we know that women and girls have hormonal fluctuations throughout their entire lifespan. And these hormonal fluctuations may impact your mood. Men don't have that. So it makes sense that this is a contributing factor. So biologically, we're at risk. Psychologically, as women, we are at risk because we have higher rates of trauma, like sexual trauma, and this is a taboo people don't talk about. We have, higher risks of things that, other people don't have to think about. Some of us have to walk down the street and just look twice around, look around our shoulder. Some of us in the workplace, we have the trauma of not being paid adequately in the way that men are. We just have so much to deal with. Attachment wise, women are often, in relationships with people who are narcissistic and violent at times. So we have these traumas to unpack, these psychological things to unpack. And then socially, the way that the world is set up, we have to be moms, we have to be caregivers to our elderly parents, we have to work, we have to be kind, but also, do all these things that are not, that burden is not placed on men. And then also socially, there are things in the environment and just the way that society is set up that makes it difficult to be a woman. So it makes sense, right? So thinking about all these things, including things that are within our social control, such as what we eat, how much movement we're getting, whether or not we're engaging in substance use or drinking a lot of alcohol. There are a lot of things within the biopsychosocial of a woman that contribute to depression. But if we are aware of these things, then we can also understand the science of our happiness and support areas where we need support. And another thing, women make up 80% of people who have autoimmune conditions. So biologically, think about that. Why is it that we have, this added burden on our body? Maybe it's related to all the stress. Who knows if it's hormonally related? So understanding the science of our happiness helps us to feel empowered, and then we know where to put a lot of our attention and our efforts.
Yeah, no, and I love the way you share that, because it's true. We have to know, I know it can be very daunting for someone to acknowledge all of that really deep held, stuff that maybe they haven't unpacked before. But to your point, when you understand the science, it also empowers you. And I love taking that looking at it through that lens, that, being able to use that science to help yourself overcome those issues. Now, you share in your book, you share the 5 V's, as you call it. Would you be up for sharing those with our audience, what they are?
Yes. I didn't want just to leave people with understanding the science of their happiness. I wanted them to feel as if there was something they could do about it. And the 5 V's are based off of evidence-based information that we know based on mindfulness research, positive psychology, cognitive behavioral therapy. And so the first V is validation. So this is accepting what you're going through, how you're feeling, and acknowledging it, which a lot of us don't do. I mentioned that many of us push down our feelings, but if we push down what we're going through, then that is creating a level of uncertainty. There's a term called affect labeling. When you know what you're dealing with, when you know what you're feeling, that in itself is a therapeutic intervention. So knowing and naming your feeling and accepting it, acknowledging it is therapeutic in itself. But many of us don't do that. We push through every day, And so I give people tools in the book to help them to acknowledge and validate how they feel. I was recently at a talk with these women, and I asked them how many of them have pushed through meetings in a day, but they had to eat. They were hungry and they didn't eat, or if they had to pee and they didn't pee. And everyone was laughing, but it's so true. We invalidate how we feel. We invalidate ourselves every day. So I really encourage, people to start to reflect and accept how they feel. And the second V is venting. Expressing how you feel can be challenging if you were not taught this. If you grew up in a household where you didn't talk about feelings, feelings are not going to come naturally to you. So there are many ways you can express how you feel. One of the ways that I've started to recently access is crying. Like if I feel overwhelmed, I cry a little bit and I feel better. There's nothing wrong with crying. Praying. Some people were brought up in faith-based households. Others were not. Maybe some people found faith later in life, but praying is a great way to express it. I have a lot of clients who are artists and they express their feelings through singing or performance or painting. And then, another way, especially with my younger clients, is journaling, like writing your feelings down, having that tactile, pen to paper, hand-eye coordination is really empowering for people to get out their feelings. And then the third V is values. These are things that bring you purpose and meaning in life. And so if you're not sure what a true value is, think priceless versus price tags. Many of us chase the clout, we chase the accolades, we chase the home, the partner, the perfect family, but we still end up feeling unfulfilled and unhappy. And that's because I want you to think about when you're on your deathbed, what are you going to be like? I want to do more of this. It's not going to be, I want a Birkin bag. It's going to be, I want to be spending more time with my family. I wish I had seen that sunset another time, wish I spent more time in nature, or poured into a cause that made me feel purposeful. And so I think if you're having a hard time with your values, also think, what is happiness to me? Because many times people come to my therapy office and they're like, I just want to be happy. And I said, well, what do you even know what happiness is? And they're stuck. They don't even know what happiness is. They'll list out things. Well, when I finally have a partner, when I finally have that career. And then I tell them, well, actually in research, when we measure happiness in science, we're measuring points of joy. We're adding up whether or not when you're with your loved ones, do you feel connected? When you're eating your food, are you savoring it? When you take a nap, do you feel rested? Those are the points of joy that are happiness. So think about joy as the experience and happiness as the idea. And when people chase the idea, they're still not happy. And then there's a huge reframe. So when you pour into your values every day and you're experiencing joy, that is what happiness is. It's now. It's not some point, elusive point in the future. And then the fourth is vitals. Vitals are the things that nourish your body and your brain. So when you think about you only get one body and you're here for a reason, you're the only Jessica that will ever exist. I'm the only Judith that will ever exist. So we have to take care of our body and brains. And the doctors will tell you, get good sleep, get good movement, eat the right foods. But there are these three vitals that are often ignored. Your relationship with technology, because, being on Zoom calls all day, being on your screens all day impacts your brain in ways that we still don't even fully understand. And I truly believe in the Bible of Psychiatry, the DSM, there will be a whole category dedicated to that one day. Our relationship with each other, our relations are the number one predictor of our longevity. So really think about who you're partnered with, who you spend time with at work, who you spend time with outside of work, because that could literally either give you life or take away your life force. And then the third relationship, which is important for people with high function depression, is your work-life relationship. Are you, unplugging when you leave work? Or are you still working at home? And I've been guilty of that too. And so I include those additional vitals. And then the fifth V is vision. Are you planning joy? Are you celebrating your wins? And again, it doesn't have to be grand. Today, like I got my daughter to school on time, did a school meeting, and I still was able to drink my coffee in peace, right? These are things that are important. Little wins are so important, but you should also celebrate your big wins. Many times I treat clients who they'll get a degree and they'll stuff it under their bed, like they won't celebrate. They won't go to the ceremony. I want you to start to celebrating your wins. Again, there's only one you. So you have to be your cheerleader. You have to love yourself, because if you are not taking care of yourself, people pick up on that, you projecting that into the world. And it's really tempting for people with high functioning depression to want to do all the 5 Vs. But again, pick one or two, tap into one or two every day, and think about it this way. If you didn't get any points of joy today, there's an opportunity to get a point or two tomorrow. And if you didn't get a point or two tomorrow, you can always get try again. And that's a reframe that's been very powerful. It's more attainable than trying to chase this idea of happiness.
Thank you so much for sharing that. That is so just such valuable information. And I love the idea of just starting with one or two. I think there, especially I find, for people who may be inclined to pour and pour and pour into work or into doing as a way of coping, whether they recognize it or not, I think it's really important for those people. And I'm talking about myself here. Like, it's important to hear that it's okay to start with one or two things and to do that. So I think that's such a wonderful way of looking at it. On that note, something I've really fascinated by is the stories that we tell about our journeys. And maybe this is just me being like an elder millennial, like, having grown up with like the whole like boss girl hustle culture in the background. But sometimes it seems that there is this burnout is like an inevitable part of the story. And I mean, it certainly has been in my past. And, that modern career success story, I feel like in some ways we've come so far, but I still feel like the burnout is, I don't, I'm not a Gen Z individual. I can't say what they see, but I'm curious to know if you have any thoughts about, how we might change the scripts for ourselves or for future generations, or things that might help make that burnout not a part of the modern success story.
Yeah, burnout by definition is related to the situation that you're in, the workplace that you're in. So it's a condition that was only recently included in our medical coding for the world and in our, criteria in the US only recently. But no one would ever disagree that it didn't exist before that, right? It's not like, oh, burnout only started existing when we put it into the coding. No, it's been around, right? Just like imposter syndrome. It's been around. It's not in any coding, but maybe one day it will be, but we will not say that it doesn't exist, right? We know it. So, burnout typically should get better when you leave the situation. But for many people, especially women, it doesn't, because you have two careers. You have your home life and you have your work life. So, there's so many opportunities for you to be burnt out because, you play multiple roles. And then I want people to think about, well, why is it that we end up in these roles? In my book, I talk about a condition that was removed from the DSM called masochistic personality disorder. And these are people, and when people think masochism, they think sexual masochism. This is not that type of masochism. This masochism is the bending over backwards for people, even though you are depleted. It's the making choices so that others benefit, even though it robs your joy. It's being this, martyr type role, and people take advantage of it. And I do think that people don't realize how that plays a role in terms of their past trauma. For example, in PTSD research, there's over 30 symptoms of trauma, but how come we only know about one or two in the general public, right? We only know about like hypervigilance or like flashbacks or nightmares, things like that, avoidance. But people don't correlate trauma with low self-worth. And it's actually on that checklist. In my lab, we use something called the CAPS-5, which is what people use in combat veterans, but we apply it to all type of PTSD and trauma. And one of the symptoms of trauma is feeling self-blame, as if you kind of deserved this thing that happened to you, and, low self-worth. So if you understand that maybe something in the past led you to believe that you're not worthy, so you end up in these people-pleasing roles where you're bending over backwards, that's going to help you to make better decisions. Maybe you're not going to say yes to that project because you know that you're worthy. You know that you're good at what you do. You know that, that's a core belief that, oh, they won't like me. They won't call me again if I don't do X, Y, Z. No, you challenge that belief and you say, no, I actually belong here and I did a great job and they should want me and I don't have to burn myself out to be here, right? And when you start to realize that all of these behaviors are tied to these past unresolved things that happened to you, and you make different decisions in life, then you have more control over whether or not you burn out. But many of us, we continue to run ourselves ragged because we don't know what the core is, why we do this in the first place. And so that's why I encourage people to understand the science of their happiness. When you understand what's making you unhappy, then you know how to protect what will make you happy. And you'll fight for that versus burning yourself out and running yourself ragged. Maybe you have ended up in relationships where you're carrying the weight. Maybe you're the one who's doing everything. Well, let's understand where that came from so we can start to challenge that and set up better boundaries for you. But if you don't understand how you became into this situation in the first place, if you don't understand what happened to you that led to these behaviors, then you're just going to feel lost. You're just going to be trying these things that don't work. You're going to be going to the spa and still feeling burned out. You're going to be taking a day off and sleeping through it and not doing the things you wanted to do. You're not going to feel as if you have a better understanding. You're going to feel lost. And so I want people to understand how it is that they ended up in these situations to begin with. Understand the science of your unhappiness so you understand the science of your happiness.
I love that. Thank you so much for sharing that. I think that's really important. And I just knowing my audience a little bit and some of the things that they share with me that they're struggling with, I think a lot of people will really benefit from hearing that. So thank you.
Thank you. I hope they do.
So this has been such a wonderful conversation. I only have just two more questions for you. One, just if people want to connect with you, learn more about your work, buy your book, what's the best way for them to do that?
Well, they can take these assessments online. They're free. When I started talking about anhedonia and, that blah, meh feeling that a lot of people can't pinpoint, that lack of joy, like when you're eating, you're not excited. When you're intimate, you're not enjoying it. When I first started talking about it and people started taking these quizzes online, it like literally broke my website. I got 10,000 people doing it. So learn about, where you are on the trauma scale, on the anhedonia scale. You can take the quizzes at drjudithjoseph.com. You can follow me at Dr. Judith Joseph and on all the socials. And then you can buy my book on my website as well. And then when you pre-order before the April 8th, you have access to courses. And I have this playlist with all these experts who also shared about a time when they were masking hidden struggles and how they got through it. It's called like the High Functioning A Affirmations playlist. There are all these bonuses so you can start, learning about yourself and the science of your happiness even before you get the book. But that's the best way to find me.
Amazing. And we'll be sure to link to that in the show notes to make it easy for people to find you. So, okay, Dr. Judith, I have one more question for you. I ask everyone on the show this question because I just love that there's so many different ways of interpreting it. And I understand too that it can evolve one day to the next. But today, at this moment in time, as we're talking, what does healthy living mean to you?
Healthy living for me is healthy relationships. And I grew up in a family with 4 kids. My dad was a pastor. It still is. He and my mom still are very active in the community. And we spent most of our childhoods reaching out and connecting with people. And that for me gives me purpose and meaning. And that's why I do what I do. I teach doctors at NYU how to talk to the public about mental health. I have a massive social following. And that's because connection means so much to me. And when I meet with my team, several times a week, I have to feel connected to them. With my daughter, I have to be connected to her, so connections and healthy, positive connections, that's happiness to me.
Thank you so much for sharing that and for being with us today.
Thank you for having me.
And for all of you guys who are out there listening, thank you as always for being here. I so appreciate your time and your energy. If you like what you hear, please consider leaving us a 5-star review on Apple Podcasts. They do matter, and they help me continue to bring you great guests like Dr. Judith. So as always, guys, I hope you have a wonderful day, and we'll talk soon. Thank you for listening to Drama-Free Healthy Living with Jess Cording. We'll see you next time. And just one more thing. I may be a dietitian, but I'm not your dietitian. The information in this podcast is meant for educational purposes only and is not intended to diagnose or treat any medical condition. It is also not a replacement for individual counseling. Always check with your healthcare provider for questions related to your own health and well-being.